I'm here to provide you with some information about corneal collagen cross-linking, its benefits and risks so that you can make an informed decision concerning this elective procedure. Corneal collagen cross-linking was first developed in Germany in the late 1990s by researchers at the University of Dresden. Corneal collagen cross-linking using riboflavin and UVA light was FDA approved on April 18, 2016. Collagen cross-linking is a minimally invasive procedure that uses riboflavin, or also known as vitamin B2, and UVA rays to strengthen the connections between collagen fibers within the cornea. First, riboflavin is applied over the surface of the eye, then controlled rays of UVA light are exposed to the surface. Corneal collagen cross-linking is used to strengthen the cornea and prevent progression of ectasia. You may be a candidate for a corneal cross-linking if you have keratoconus or ectatic disease of the cornea. Specifically, you may be an ideal candidate for the procedure if you have a progression of corneal ectasia, and this is defined as an increase of 1 diopter in terms of the steepest keratometry, an increase in 0.5 in the manifest refractive spherical equivalent, and a reduction in central corneal thickness in 3 tomography measurements within 6 months. Other diseases that may be candidates for collagen cross-linking are pellucid marginal degeneration, Terrian marginal degeneration, and post-refractive surgery ectasia. I'm now going to discuss the steps of the procedure. First, the epithelium layer of the cornea is removed using standard aseptic technique using topical anesthesia. Then 1 drop of riboflavin is topically applied to the eye every 2 minutes for 30 minutes. After these 30 minutes, the clinician will examine your eye under slit lamp to check for flare in the anterior chamber. Additional riboflavin may be applied if necessary. Next, a controlled and regulated radiation of 3 milliwatts per centimeter squared is delivered to the eye for 30 minutes, and topical riboflavin will continue to be administered every 2 minutes during this time period. Many patients have undergone corneal collagen cross-linking with great results. In general, corneal collagen cross-linking is very safe. There are, although, a few side effects that may occur after collagen cross-linking to be aware of. About 3% of patients will lose some vision in the treated eye as a result of haze, scarring, corneal surface shape irregularity, or infection. In most cases, this visual loss is potentially reversible with a corneal transplant. Without collagen cross-linking treatment, at least 20% of all patients with keratoconus will eventually require a corneal transplant. There are a few complications to be mindful of in considering this procedure. These include temporary stromal edema, corneal haze, corneal scarring, and sterile infiltrates, an eye infection, diffuse lamellar keratitis in a post-LASIK patient, and photosensitivity, eye pain, or swelling. Thank you for listening. Just remember that corneal collagen cross-linking is an elective surgery, and it is completely your choice to proceed with this procedure. The procedure is very beneficial to strengthen your cornea, and it is useful in more than 90% of cases. Although your eye will be sore or a bit hazy for the first week, most patients can resume contact lens wear and return to work after 1 week. As with all operations, there are a few risks. It is important to discuss all of your questions with your physician at your next visit to determine if you are a good candidate for corneal collagen cross-linking. We hope this video was helpful, and we thank you so much for your time.